The partisan debate over healthcare continues. According to the Center for Responsive Politics, the healthcare industry has poured millions of dollars into the midterm elections. Following the failed attempt to repeal the Affordable Care Act, Republicans have been accused of trying to eliminate coverage for people with pre-existing conditions.
Avik Roy has a proposal to replace Obamacare. He says it would benefit everyone. He's the president of the Foundation for Research on Equal Opportunity and the policy editor at Forbes. Avik joins us now. Avik, great to see you again.
Glad to have you.
Thanks, Krystal.
The Republican plan right now, or actually, let me step back for a moment. What have the Republicans done since they have had the House and the Senate presidency on health care? Just take us to that place first. What has happened?
Well, they obviously failed to repeal and replace Obamacare. The big things have actually come from the White House. So the executive branch has actually done a number of significant things that haven't gotten a lot of attention because we talk so much about Russia and social media and all that kind of stuff. But there have been a number of things, particularly in the last week, that are actually very impactful to how healthcare will go forward in this country. They passed a rule through the HHS that they're proposing to allow companies, small companies, to give people HRAs, health savings account-like benefits that they can use to shop for their own coverage on the Obamacare exchanges. There was a new initiative that came out last week to tackle the high cost of prescription drugs in Medicare through tying it to an international index of European countries' prices to bring down prescription drug price costs. So there are a lot of things the administration is doing, but in terms of those big congressional reforms that we normally think of over the last 10 years, we're not seeing a lot of that.
Well, that brings me to my next question on Kanye. No, just kidding. Just kidding. So one of the rubs here always in this debate is Republicans want to say, you can have everything you like about Obama. So the pre-existing conditions, all that good stuff you like, you can have, and we're going to get rid of all the pieces that you don't like. Inevitably, there are trade-offs here, right? So on the pre-existing conditions piece alone, how can you continue to require health insurance companies to cover people who have pre-existing conditions without keeping some of the other infrastructure of Obamacare? How does that work?
So my view is actually that the conventional wisdom is wrong here. Think about it this way. When you go to a restaurant, the federal law says that that restaurant has to serve you regardless of your race or your gender or your nationality. Same thing is true with health insurance. If you're sick, you can require that a health insurance company offer you coverage. The question isn't whether they offer you coverage. The question is what the price of that coverage will be. If you're healthy and your premium is lower, relatively speaking, and you're sick and your premium is higher, relatively speaking, that's where the economics start to get complicated. So that's a subtle thing about Obamacare that a lot of people don't appreciate. It's not so much the guarantee that an insurance company offers you coverage, it's the price at which that coverage is offered.
Right, because if the cost is overly high, then even though you technically have access to it, you don't functionally have access to it because the cost is prohibitive.
So the real question is, how do you subsidize coverage for people who are sick, whose premiums would be really high but otherwise couldn't afford coverage? The way Obamacare does it is it says, healthy people, we're going to ask you to pay higher premiums if you're uninsured through the exchanges. A more straightforward way to do it is just spend the money to say, you know what, if your premium is really high and unaffordable to you, we as taxpayers are going to come together and say, we're going to help you with premium assistance payments so that you can afford your premium. So Obamacare does that too, but I think on balance, the problem is healthy people are basically priced out of the market if you're uninsured and trying to sign up for coverage on the exchange, and that's why enrollment in the exchanges has been a lot lower than originally was hoped.
Well, and this was part of the problem with the Republican plan, was that there did not seem to be enough money to subsidize those individuals who may be sick, who may have pre-existing conditions, to be able to get coverage at an affordable price. It seemed like the amount that they set aside was not nearly enough to cover that cost.
Yeah, I think one of the mistakes Republicans made was the problem with American healthcare basically is we subsidize healthcare a lot for upper income people through the tax code, through Medicare, where if you're a billionaire but you're eligible for Medicare, we all pay taxes, so that person, Warren Buffett, can get subsidized healthcare. We should shave money off of that to make sure that lower income people can afford health coverage. And so the problem really isn't that...
So it's means testing, right?
Means testing. That's what we should do, and in order to help uninsured people afford coverage. But what Obamacare did is it did that to a degree, but it also created this regulatory mess in which young and healthy people are now priced out of the market. So some people are being helped by Obamacare, but there are other people whose premiums have gone up a lot.
That's what I want to ask you. Who's gotten the short end of the stick here with Obamacare? Who are the people that don't like it, are suffering, and feel like this was not what was promised, other than that they can't keep their doctors, which we all know.
Yeah, overgeneralizing, people who are uninsured, who are younger, people who are uninsured, who are healthier, and people who are uninsured whose incomes are, say, in the $30,000, $40,000, $50,000 a year range. So the lower middle class to working poor, people for whom the Obamacare subsidies aren't enough to cover the increase in premiums that they're seeing. So there is a population that was, you could say, poorly served by Obamacare. But there were a lot of people who now do have coverage that were uninsured under the previous
What is the
regime.
status of the individual mandate right now?
The individual mandate still actually is on the books, but the fine for not buying insurance is $0. So the mandate is still technically there, and that gets us to this new litigation about pre-existing conditions that's now burbled out of Texas called Texas v. Azar, where a bunch of conservative states have sued saying, well, that old Supreme Court case that upheld Obamacare, that was based on the idea that pre-existing conditions and the individual mandate and all these different pieces had to go together. But now that the individual mandate has been sort of repealed, isn't that Supreme Court decision moot? Shouldn't the whole thing be thrown out? I think it's a waste of time. I think the idea that the John Roberts Court is going to overturn Obamacare.
Round three? I don't think so.
It's not going to happen.
Are we ever getting rid of Obamacare, in your opinion, under any circumstances? Can you foresee that realistically?
Not in its entirety. I mean, look, important pieces of Obamacare have been repealed, right? So the individual mandate has been effectively repealed. IPAB, this complicated or controversial Medicare provision to try to lower Medicare costs through an independent board, that was repealed. The Class Act, which was a long-term care element for elderly people with disabilities, that was repealed. So there have been parts of Obamacare that have been repealed. But I think the broad idea that we're going to try to make sure that almost everybody in America has health insurance, I don't think you're going to repeal that.
What about on the president's pledge to lower the cost of prescription drugs? Where are we with that, and what would need to be done to get that done? Because the idea he campaigned on, something that Democrats campaign on, we're going to negotiate drug prices, right? He hasn't followed through with that. What has he done, and what more could he do?
Yeah, so I was alluding at the beginning of our segment to this new initiative which was just rolled out last week, which I've written about at Forbes, where Medicare Part B drugs, so these are drugs that are typically intravenous infusions where you're sitting in a chair, you're plugged into a machine that infuses the drug into you as opposed to buying pills from a pharmacy. Those drugs, if you are on Medicare, are covered by this part of Medicare called Medicare Part B, in which the government basically pays a set price that's kind of like a quasi-price control based on a sort of a price that's generated by the market. But that price is often very high. So those are the drugs where in America we're paying 2, 3, 4 times what advanced European countries are paying. And this is something that's irked the president a long time. He really believes that we're being ripped off by these other countries that are freeloading off of the high prices in the United States. So he's pushed his HHS secretary, his administration, to correct that. And so they rolled out this proposed rule last week in which going forward, they're going to pilot an idea in which instead of paying this 2 to 3 to 4x the price, you're going to pay a price that's tied to a basket of international countries like Britain, like France, like Canada, like Germany, and basically align what we pay for those drugs to what those European drugs are being charged by those countries. So that's a fairly controversial idea on the right, because it sounds like something that actually is more democratic, more friendly to Democrats. So on the right, there's been a lot of debate about this, but the president has scrambled a lot of the ideology on drug pricing. He's very much a guy who wants to get drug prices down. He's willing to borrow ideas from more market-oriented people and Democrats. This idea, actually, Tim Kaine, the senator from Virginia, was the guy who first proposed this, and Alex Azar was testifying before the Senate Finance Committee, and that's where he got the idea. So this is actually an idea that, though it's coming from the Trump administration, was actually suggested by a Democratic senator.
Now, the Democrats are more than ever embracing single payer, which I remember actually talking to you about Obamacare back when it was being passed, and there was a lot of discussion about how they're never really going to go for single payer, though. That's what people were saying, and now here we are, and the Democrats are pretty open that that's something that's going to get pushed, at least in the 2020 election. Why is that the direction they're going in now, and what problems do you have with single payer? I know that this is probably a 3-hour discussion that we only have 3 minutes for.
Tell us in 15 seconds.
But yeah, exactly. What's your take on it? The biggest thing is always they say it's going to save money and give everybody more coverage. How does that work?
Well, I think in healthcare, when it comes to the politics of healthcare, the simplest ideas are always the most popular. You know, this idea, single payer, just get rid of all the complexity, have the government be in charge of it and everything will be fine, is a very simple idea and therefore a very appealing idea. But the reality of how you get from here to there in America is very, very hard. Because right now we have this patchwork system in which There's Medicaid, which is basically mostly funded by states, or a chunk of it's funded by states. You have the employer-based system, which is funded through the tax code. You have Obamacare, you have Medicare. Changing all that into one big system would involve massive fiscal dislocations that would increase federal spending over a 10-year period by over $30 trillion, which would almost double federal spending. So that's almost impossible to do, just whether you like single payer or not. So I think as an idea that could actually happen, single payer is pretty unrealistic, and most people on the left who are smart about policy understand that. I think the real issue of that's really interesting about this is, can you build bridges to single payers? I think what the smart kind of liberal think tank types and smart Democrats are trying to do is, are there ways to add single payer-ish elements to the existing healthcare system? Can you bring a public option in Obamacare? Can you give traditional Medicare more of an edge over Medicare Advantage, which has more of a private insurance component? Can we lower the eligibility age from 65 to 55 so more people are on Medicare, which is a form of single payer after all? So there are things like that that I think Democrats can build on this current system to make it more government-oriented, but a true single-payer system is not going to happen. And I think what's going to be interesting is if the base of the Democratic Party demands that the Democratic nominee in 2020 is full-throated single-payer going into that 2020 election, that's going to give the president a lot of room to propose an alternative to single-payer that has more broad political appeal.
I mean, on the politics, to your point, 70%, we just did a poll here, 70% support Medicare for all. And I think people look around the world and say, every other developed country has figured this out, so why can't we? And they get better outcomes in a lot of regards and have lower costs. So I think it's a hard argument to make to the American people that it's not possible, even though I hear the challenges getting from where our system is to that idea. But I think, like you said, people look at it and say, Medicare works pretty well for me. Why not just extend it to everyone?
What do you say to these liberal think tank types you're mentioning about when they're like, well, what about Denmark? We just had this conversation with Jen a week ago.
Canada, I mean, there's lots of places where they have a more successful healthcare system. Not that anybody has it perfect, but more successful than what we're doing.
So what about Canada over there?
Well, Krystal, about those polls, if you ask the poll question, do you want Medicare for all, you get a lot more support. If you say, do you want Medicare for all if it means your federal income taxes are going to double, then a support collapses. And I think that's part of the thing, is that if you don't litigate the costs along with the benefits, you get much more favorable polling answers. So a lot of people don't necessarily understand what the trade-offs are of a policy like Medicare for all. And that's going to be the challenge if Democrats do line up in the 2020 election.
They will be. They will be. That much I can promise you. Avik Roy, thank you so much. So great to have you. I hope you come back and see us again.
Absolutely.
Great to see you.